Hello, welcome to Dietitian Review. I am your dietitian, Fechi. And if you're new to this channel, this is a channel where you get evidence based nutrition information that will help you live a healthy life. If you've not subscribed to this channel, I'd like you to click on that subscription button and click on the notification bell so that you'll be able to know when we release our subsequent video. We are still on our, diabetes series, and we've been on this series for quite a long time now. If you've not been following up with this series, I'd like you to go to the description and you will see the link that will lead you to all the videos we've done on this series, from the beginning of it, from the history of diabetes to the explanations to the types of diabetes to the symptoms to the treatments to everything that you need to know about diabetes. You're going to find it right here, and it's only on this channel. Okay, so welcome to another episode. On this episode, we'll be talking about dietary treatment of diabetes. Okay, going to be looking at the diet itself and how we use diet in treatment of diabetes. You need to know that diabetes is one condition that is related to food. Okay, it is not a medication problem, right? It is a food problem. Now, the problem is that your body is not able to metabolize the food that you're eating. Okay, so when you want to treat diabetes, you don't just treat it medically, because medicine will not necessarily solve the whole problem of diabetes, because you are a human being that will always eat food. Okay, you need food to live, and so you cannot depend just on your medications to solve the problem of diabetes. You must start seeing it from that concept that it is a food problem. And because it's a food problem, you need to be looking at it from that perspective. Okay. And because it's a dietary problem, you need to solve it from that perspective. I am not saying that you shouldn't, use medications. No, medications have their role, and the role they play is also very vital. Okay, so for you to solve that problem, you need to look at it from this holistic point of view, that it is first a food problem and then a medication problem. All right, so start looking for the solution. Okay, once you see it from this perspective, then the next thing, which is one point that you need to see, one treatment that you need as a person who is diabetic, is you need to consult a dietitian. I've discovered over the years that many people look at diabetes and they look at the doctor to be the only person that will solve the problem. But that is not true. Okay, the doctor will diagnose the problem, the doctor will prescribe the medication, but the doctor will not give the dietary counseling that you need to solve the problem. And this is where many of you get it wrong. Okay, now the doctor knows a thing or two about diet. Okay, the same way I, as a dietitian, I know a thing or two about medication or medicine. I did anatomy and physiology back in school. Okay, but it doesn't make me an expert in medicine. I can't claim that I'm an expert. Okay, I may understand some of the bodies, some of the organs and what they do, and probably have an understanding of what is happening in the system for every condition. But I am not in that place to say that I can prescribe a medication for somebody who has issues. The same way that a doctor understands the anatomy and physiology of the organs that handles food, They know where the fat is treated, they know where the protein is treated, they know where the carbohydrates, the digestion of carbohydrates, where it starts, and they can have an idea. But the truth is, they don't understand what food, the quantity of food you need to eat, the kinds of food, in details, with an understanding of what exactly is required at that point. Okay? So they don't have an idea of what we call nutrition care process. Now, nutrition care process is a process we use in treatment of different nutrition related conditions. And this is not what the doctor is privy to. Okay? So you need to know that when you have diabetes, the first person you need to meet after the doctor is your dietitian. And so the doctor should be in a better position to even refer you to one. So one thing you must do as a diabetic is to go see a dietitian. That is the first thing you need to do to start this journey, this dietary treatment of diabetes. Okay, the dietitian will diagnose you, nutrition diagnosis, they will do their, everything. That is where they will determine the amount of food you need to eat, the quantity, and then tailor it down to what is available and what you can afford. Okay, so that is what the dietitian will do. They know the quantity, the exact quantity of food you will need to eat for every food. They will plan a diet for you that will include the quantity of food, the group of food, the kinds of food that you need to eat. For a dietitian, okay, there is nothing like a diabetic diet. Now, I know you are shocked at this, but that is the truth. There is nothing called a diabetic diet. Okay? A diabetic patient can eat almost all the foods. Okay? The only difference about the diabetic patient and the food is that the dietitian will plan that diet in such a way that it will capture the exact amount that this person needs. Okay, the dietitian during diagnosis will get to find out, your activity level for the day. What exactly do you do? Okay, how have you been eating, your dietary history? So from this diagnosis, the dietitian will make a planned diet for you that will tell you exactly what you need to eat. But remove your mind from that notion that there's something called diabetic diet. It doesn't exist. Okay? So one diet that the dietitian will recommend is plant-based diet. Okay? Plant-based diet is one diet that has been discovered to help a lot of diabetic patients. Okay, I'm not saying that you shouldn't eat animal, source of food. No, that's not what I'm saying. But you need to know that plant-based diet has more to offer to a diabetic person. And the reason is simple, because it contains fiber, which is very essential. Okay. Fiber is essential for a diabetic patient, and most fibers are found in plants. Okay. So there are no sources of fiber from animal sources. Okay. Fibers are found in plants. Okay. So there are no fibers from animal sources. Fiber, they are from the plant sources, and that is why the dietitian will always recommend a plant-based diet, from your vegetables to your fruits to your whole grain to your legumes. They are all plant-based products. You have to limit the amount of fat that you eat, especially your saturated fat. In fact, there are many studies that have discovered that saturated fat is the major cause of insulin resistance in diabetic, patients. Okay. Most studies that have been done before now have found out that once you limit saturated fat, okay, the patient over time with other, diet will always, improve in their insulin resistance. Okay, so you need to find out, those saturated fat. Okay, so majorly how you need to know is that unsaturated fats are usually found from plants. Okay, and not just plants, they are found from nuts and seeds. Okay, they are found from nuts and seeds, and others, some such as avocado oil, olive oil. These are oil that are healthy for somebody who is diabetic. Okay, you need to be sure of what you are eating. So eat less of fat, especially saturated fat. Let it be removed from your diet. Eat foods that are low on glycemic index. I'll be doing a separate video for glycemic index, okay? But I need to let you know that glycemic index is just a rating that helps you understand how food can increase your blood sugar level, okay? So eat foods that are low on glycemic index because they will help you, not to increase your sugar level. This is another vital one. I mentioned it earlier. Eat foods that are high in fiber. Now, what is being high in fiber? You know, eat about 40 grams of fiber per day as a diabetic patient. Okay, so there should be some amount of fiber in your breakfast. There should be some amount of fiber in your lunch, and also there should be amount of fiber in your dinner. So spread your fiber across board. Okay, let it come from vegetable, let it come from fruit, let it come from whole grain, let it come from your legumes. So don't depend wholly on just vegetables. I know vegetables, they are rich in fiber, but you can just spread it across. Eat foods that are rich in fiber, and it will help improve your fiber stores, which also helps your sugar. One other thing that you need to do once you start your dietary treatment, you need to talk to your doctor about it. Okay, your doctor needs to know because he will know when to, be very cautious of the medications. Whether you're on insulin or you're just on drug medications, the doctor will be cautious about it to know when to reduce, the dose and all of that. So talk to your doctor whenever you see a dietitian and you start your diet treatment. Okay, don't do it in isolation of your doctor because it may lead to hypoglycemia, and that's dangerous. So talk to your doctor whenever you start so that your doctor will be in the know of what is happening. And also, you should also learn to visit. Okay, visit your doctor from time to time so that you will have appropriate checkup. Now, the final thing you need to do that will help you treat this diabetes, with your diet, you need to join our 30-day, secret code program. Okay. This is a program where we have structured some lessons that we will give for 30 whole days. And not just the lessons, we will monitor you, we will hold you by the hand and help you understand this particular condition. Okay, this means that you're going to be accountable to us in this 1 month, and by the end of this 1 month you would have been so knowledgeable that you can now control your blood sugar by yourself. Okay, in these 30 days we're going to be holding you by the hand and showing you what exactly works. Okay. And then, of course, we have a weekly troubleshooting call where we engage you in a face-to-face, okay, conversation, okay, over the phone. We'll ask you questions about how your sugar is, what has happened in the last 1 week, what exactly you're doing, okay. We want you to be accountable to us, and because you're accountable to us, I tell you, it is not going to be, the normal way you treat your diabetes. Okay. Now, what happens is that we help you become responsible for your health. Okay. So don't take this for granted. This is one program that we have organized to help you achieve, a very good sugar level. Okay. So if you're interested in this program, it is going to be a program that will help you become accountable to us and then learn how to control your blood sugar, by yourself in 30 days. Okay. You will learn everything that needs to be learned. Okay. And we'll be teaching you in a private group. Okay. So if you're interested, click the link to my WhatsApp and chat me up on WhatsApp, and I will be there to welcome you and tell you what you need to do to be part of this program. Okay. Now, this is where we will call it a day on this episode of our show. Now, if you've not subscribed to this channel, I'd like you to click that subscription button and click on that notification bell so that you'll be able to know when we release our subsequent video. If you've gotten value from this video, why don't you give us a thumbs up, like this video, and help us share it with your friends so that more people will have access to this video. Thank you so much for listening, and I'll see you next time. Bye for now.